I'm a neurosurgeon at Riverside Memorial Hospital in Portland, Oregon, or at least I was, until I submitted my resignation 4 months ago. You can call me Dr. Jonathan Blackwood if you want, though most people in the surgical department just called me the brain surgeon. During my 23 years there, I've performed over 4,200 craniotomies, removed countless tumors, arteriovenous malformations, and operated on every type of brain trauma the Pacific Northwest could deliver to my operating table. But what I'm about to tell you about are the 4 cases that made me question everything I thought I knew about human consciousness, neurobiology, and the very nature of what we call reality. These cases ultimately led me to abandon neurosurgery entirely and flee the medical profession like a man escaping a house fire. Riverside Memorial is the largest trauma center between Seattle and San Francisco, a massive medical complex that serves nearly 2 million people across Oregon, southern Washington, and northern California. It's where they send the cases that would kill patients at smaller hospitals, the complex brain aneurysms, the inoperable tumors buried deep in critical brain regions, and the traumatic injuries so severe that most surgeons would simply declare them hopeless and wait for the inevitable. During my nearly quarter century there, I thought I had seen every possible variation of human brain pathology. I was arrogant enough to believe that the human brain held no more mysteries for me, that every neurological condition could be understood through careful analysis and precise surgical intervention. I couldn't have been more catastrophically wrong. These 4 cases didn't just challenge medical science, they shattered it into pieces so small that I'm still trying to sweep up the fragments of my former understanding of reality. Let me establish my credentials so you understand that what I'm about to tell you isn't coming from some fringe medical practitioner or conspiracy theorist. I graduated summa cum laude from Harvard Medical School in 1995, where I was awarded the prestigious Lange Medical Publications Award for Academic Excellence. My neurosurgical residency was completed at Johns Hopkins Hospital under the mentorship of Dr. Catherine Brennan, one of the world's foremost experts in stereotactic radiosurgery and deep brain stimulation techniques. Following my residency, I spent 4 additional years in specialized fellowship training, 2 years at the Mayo Clinic, focusing on complex spinal neurosurgery, and 2 years at the University of California, San Francisco, studying advanced microsurgical techniques for treating brain tumors in eloquent areas, those critical regions responsible for speech, movement, and consciousness itself. When I joined Riverside Memorial in 1999, I was 31 years old and considered one of the most promising young neurosurgeons on the West Coast. My colleagues respected my technical precision, but what truly set me apart was my obsessive attention to diagnostic detail. I never entered an operating room without knowing exactly what I would find inside a patient's skull. Every MRI scan was analyzed from dozens of different angles. Every symptom was documented and cross-referenced with thousands of similar cases in the medical literature, and every possible surgical complication was planned for and rehearsed mentally before the first incision. This methodical, almost paranoid approach to neurosurgery earned me a reputation for being able to successfully operate on cases that other surgeons deemed inoperable. Over the years, I became the surgeon that other surgeons called when they encountered something they couldn't handle. My success rate for complex brain tumor removals was 94%, compared to the national average of 78%. My mortality rate for emergency traumatic brain surgery was less than 3%, when the typical rate hovers around 12%. I'm telling you this not to boast, but to emphasize that when I encountered the 4 cases I'm about to describe, it wasn't because I lacked experience or skill. These cases defied everything I knew about neurosurgery, neuroscience, and the fundamental laws of biology, because they were genuinely impossible, not just difficult or rare, but actually impossible, according to every principle of medical science I had spent 3 decades learning and perfecting. Riverside Memorial's neurosurgical department handles approximately 2,800 brain operations annually, ranging from routine tumor removals to complex reconstructions following massive trauma. We have 8 full-time neurosurgeons, 12 residents at various stages of training, and the most advanced surgical technology available anywhere in the world. Our operating suites are equipped with intraoperative MRI scanners, computer-guided stereotactic systems, and neurophysiological monitoring equipment that allows us to map brain function in real time during surgery. I'm providing these details because I want you to understand that what I'm about to describe didn't happen in some backwoods clinic with inadequate equipment and poorly trained staff. These events occurred in one of the most sophisticated medical facilities in North America, witnessed by dozens of highly trained medical professionals, and documented with the most advanced diagnostic imaging technology available to modern medicine. The case that began my journey into medical nightmare started on November 3, 2021, when a 34-year-old freelance photographer named Evangeline Thorne was brought to our emergency department following what initially appeared to be a routine motorcycle accident on Interstate 84, about 15 miles east of Portland. Evangeline had been riding her Kawasaki Ninja northbound around 2:30 in the afternoon when a semi-truck driver, apparently falling asleep at the wheel, drifted into her lane. According to witness statements, Evangeline swerved to avoid the truck, but lost control of her motorcycle at approximately 70 miles per hour. She was thrown from the bike and slid nearly 200 feet along the concrete highway before coming to rest against a steel guardrail. The first responders who arrived at the scene reported finding Evangeline unconscious with obvious signs of severe head trauma. Her motorcycle helmet had been completely shattered on the left side, and there was significant bleeding from her left ear and nose. Her breathing was shallow and irregular, her pulse was weak but detectable, and her pupils were unequal in size and poorly reactive to light, suggesting increased intracranial pressure. The paramedics intubated her at the scene and rushed her to Riverside Memorial with a preliminary diagnosis of severe traumatic brain injury. During the 20-minute ambulance ride, Evangeline's condition deteriorated rapidly. Her blood pressure began dropping, her heart rate became erratic, and her Glasgow Coma Scale score fell to 4, indicating deep coma with minimal brain function. When she arrived in our trauma bay at 3:15 p.m., Dr. Sarah Martinez, our head of emergency medicine, immediately called for a neurosurgical consultation. I was in my office reviewing surgical notes when my pager buzzed with the emergency code. Within 3 minutes, I was examining Evangeline Thorne, and within 5 minutes, I knew she was going to die without immediate surgical intervention. The initial CT scan revealed what I expected to see based on the mechanism of injury and her clinical presentation: a massive epidural hematoma on the left side of her brain. An epidural hematoma occurs when bleeding happens between the skull and the dura mater, the tough membrane that surrounds the brain. As blood accumulates in this space, it creates pressure that compresses the brain tissue and can quickly become fatal if not surgically evacuated. In Evangeline's case, the hematoma was enormous, approximately 180 milliliters of clotted blood pressing against the left temporal and parietal regions of her brain. The mass effect was so severe that her brain tissue was being pushed across the midline of her skull, a condition called midline shift that is often incompatible with survival. But the epidural hematoma, while life-threatening, wasn't the most disturbing finding on her CT scan. What made me pause and request additional imaging was a series of small, perfectly circular lesions scattered throughout both hemispheres of her brain. These lesions appeared to be about 3-4 millimeters in diameter, and they were arranged in what seemed to be a geometric pattern, too organized and symmetrical to be the result of traumatic injury. I had never seen anything like these lesions before. They didn't match the appearance of embolic strokes, tumor metastases, multiple sclerosis plaques, or any other pathological process I was familiar with. Most puzzling of all, the lesions appeared to be glowing slightly on the CT scan, exhibiting a radiodensity that was inconsistent with any known brain pathology. While the radiology department performed additional MRI sequences to better characterize these mysterious lesions, I met with Evangeline's husband Marcus Thorne, who had arrived at the hospital in a state of barely controlled panic. Marcus was a software engineer at Nike, a soft-spoken man in his late 30s who was struggling to process the reality that his wife of 8 years was fighting for her life. "Dr. Blackwood," he said, his voice trembling. "The police officer at the scene told me that Evangeline should have died instantly from her injuries. He said he's never seen anyone survive being thrown from a motorcycle at that speed. Is that true?" I sat down across from Marcus in the family consultation room, a sterile space that had been the setting for thousands of difficult conversations during my career. "Mr. Thorne, your wife has suffered extremely severe injuries. The trauma to her brain is extensive, and she's going to need immediate surgery to have any chance of survival. Even with surgery, I need you to understand that the odds are not in her favor." I explained the epidural hematoma and the urgent need for craniotomy to evacuate the blood clot and relieve the pressure on her brain. But I also had to address the mysterious lesions that had appeared on her scans. "There's something else I need to discuss with you," I said carefully. "The imaging studies show some unusual findings in Evangeline's brain, small lesions that don't appear to be related to her accident. Has your wife experienced any neurological symptoms recently? Headaches, seizures, vision problems, changes in behavior or personality?" Marcus looked confused. "Lesions, like tumors? No, Evangeline has been completely healthy. She's never had any serious medical problems. She doesn't even get headaches." "What kind of lesions are you talking about?" I showed him the CT images on my tablet, pointing out the small circular abnormalities scattered throughout Evangeline's brain. "We're not sure what these are yet. They don't look like tumors, or strokes, or any other condition I'm familiar with. We'll need to do more testing to understand what we're dealing with. But right now, our immediate priority is the surgery to save her life." Marcus stared at the brain scan images, his face pale. "Those things, they look almost like they're arranged in a pattern. Is that normal?" I'd been thinking the same thing, but I didn't want to alarm him further. "We'll figure out what they are after we take care of the immediate life-threatening problem. Right now, I need your permission to perform emergency surgery." At 4:45 p.m., after Marcus signed the surgical consent forms, I began preparing for what should have been a straightforward emergency craniotomy. My surgical team consisted of Dr. Rebecca Chen, my chief resident, who had been working with me for 3 years, Patricia Williams, and Janet Lopez, 2 of our most experienced OR nurses, and Dr. Kevin Murphy, our senior anesthesiologist. We had performed hundreds of emergency hematoma evacuations together, and the procedure had become almost routine. Remove a section of skull bone, evacuate the clotted blood, control any active bleeding, and close the surgical site. In most cases, if we could relieve the pressure on the brain quickly enough, patients would make reasonable recoveries. But as we reviewed Evangeline's imaging studies in the preoperative conference room, it became clear that this case was going to be anything but routine. The additional MRI sequences had revealed even more disturbing details about those mysterious lesions. "Dr. Blackwood," said Dr. Lisa Park, our chief neuroradiologist, "I've been doing brain imaging for 15 years, and I've never seen anything like this. These lesions aren't showing up as solid masses on the MRI. They're appearing as areas of increased metabolic activity, almost as if they're generating their own energy. The spectroscopy data suggests they're producing electromagnetic radiation in frequencies I've never seen in living tissue." She pulled up the MRI images on the conference room's large monitor. The mysterious lesions were much more visible on the MRI than they had been on the CT scan, and they were indeed arranged in what appeared to be a deliberate geometric pattern. There were 12 lesions in total mitos, 6 in each hemisphere of the brain, and they formed 2 perfect hexagons when viewed from above. "There's something else," Dr. Park continued. "These lesions appear to be connected by what looks like neural pathways that don't exist in normal human brain anatomy. It's as if someone has installed additional neural circuitry in this woman's brain. Dr. Chen, my resident, leaned forward to study the images more closely. Could this be some kind of congenital condition, something she was born with, that never caused symptoms until now? That's possible, I replied, though I didn't believe it. But congenital brain malformations don't typically appear as perfectly geometric patterns, and they don't generate their own electromagnetic radiation. We're dealing with something that's not in any medical textbook. The anesthesiology team reported that Evangeline's preoperative labs showed some additional anomalies. Her blood chemistry was normal for all standard parameters, but there were elevated levels of several neurotransmitters that shouldn't be detectable in peripheral blood samples. Most puzzling of all, her blood was exhibiting unusual electrical conductivity, nearly twice the normal level for human blood. Dr. Murphy, I asked our anesthesiologist, have you ever seen blood conductivity readings like this? Never, he replied. Honestly, I'm not even sure what could cause something like this. Her blood is conducting electricity, almost like it has metallic particles suspended in it, but all the metal screening tests came back negative. At 6:20 p.m. on November 3rd, I made the first incision into Evangeline Thorne's scalp, beginning what would become the most disturbing and inexplicable surgery of my entire career. The initial stages of the procedure proceeded exactly as expected. I created a large skin flap, exposed the underlying skull bone, and began the process of removing a section of her temporal and parietal bones to access the epidural hematoma. Dr. Chen assisted me with the bone removal, while the OR nurses prepared the suction and irrigation equipment we would need to evacuate the blood clot. Dr. Murphy monitored Evangeline's vital signs and anesthesia levels from his station at the head of the operating table. Vital signs are stable, Dr. Murphy reported as I completed the craniotomy. Blood pressure 110/70, heart rate 88, oxygen saturation 98%. She's tolerating the procedure well. When I removed the final piece of skull bone and exposed the durameter, I immediately noticed something unusual. The dura, which should have been bulging outward due to the pressure from the hematoma, appeared normal and relaxed. This was inconsistent with the massive epidural bleeding we had seen on the CT scan just 2 hours earlier. That's strange, I said to Dr. Chen. Based on the imaging, we should be seeing significant dural tension here. Something's not adding up. I made a small incision in the dura to assess the pressure underneath. Instead of blood under high pressure spurting out of the incision, which is what typically happens when you evacuate an epidural hematoma, there was only a small amount of dark viscous fluid that didn't look like normal blood. Dr. Chen, are you seeing this? I asked, directing her attention to the unusual fluid. That doesn't look like typical hematoma material, she replied. It's too dark, and the consistency is wrong. It looks almost metallic. I enlarged the dural incision to get a better view of the underlying brain tissue, and what I saw made me stop the surgery entirely. Where our imaging had shown a massive blood clot compressing the left side of Evangeline's brain, I instead found brain tissue that appeared completely normal, better than normal, actually. The neural tissue was a healthy pink color with excellent blood flow, showing no signs of trauma, swelling, or damage from the motorcycle accident. But that wasn't the most disturbing discovery. Those mysterious lesions we had seen on the imaging studies were visible to the naked eye, and they were unlike anything in medical literature. Each lesion appeared to be a small, perfectly circular disc made of what looked like organic tissue, but tissue that was generating its own light. They were glowing with a soft bluish-white luminescence that was clearly visible, even under the bright operating room lights. "What the hell are those things?" whispered Patricia Williams, our senior OR nurse who had assisted on thousands of brain surgeries during her 20-year career. I stopped all surgical activity and called for additional lighting and magnification equipment to be brought into the OR immediately. What I was observing inside Evangeline Thorne's skull contradicted not just our preoperative imaging, but fundamental principles of biology and physics. The glowing lesions were arranged in the same geometric pattern we had seen on the MRI, but their appearance under direct visualization was even more disturbing. Each disc-like structure appeared to be composed of neural tissue, but neural tissue that had been organized in a way that didn't exist in nature. Under high magnification, I could see that the tissue within each lesion was arranged in concentric circles, almost like the growth rings of a tree, but made of what appeared to be highly organized neurons and support cells. "Dr. Chen, I want you to document everything we're seeing," I said, my voice steady despite the fact that I was witnessing something that shouldn't exist. Full video recording, still photographs from multiple angles, and tissue samples for immediate pathological analysis. As Dr. Chen began documenting our findings, I noticed something even more disturbing. The glowing lesions were not static might, they were exhibiting organized activity. Under magnification, I could see rhythmic pulsations of light moving across the surface of each disc, and the pattern of pulsations seemed to be synchronized between all 12 lesions, that communicating with each other. Dr. Chen said quietly, "Look at the timing of those light pulses. They're coordinated across all the lesions." I had Dr. Chen take a small tissue sample from the edge of one of the glowing discs for immediate frozen section analysis. When she touched the lesion with the biopsy forceps, something happened that made everyone in the operating room freeze with terror. The moment the forceps made contact with the glowing tissue, every piece of electronic equipment in the OR began malfunctioning simultaneously. The anesthesia monitors started displaying random readings, the surgical lights began flickering rapidly, and the electrocautery unit began firing spontaneously, filling the room with the smell of burning metal. "What's happening to the equipment?" shouted Dr. Murphy as he tried to regain control of his anesthesia monitoring systems. Even more disturbing, the moment Dr. Chen touched the lesion, Evangeline's EEG, which had been showing the flat, minimal brainwave patterns typical of deep coma, suddenly exploded with activity. The EEG tracing showed the kind of complex, high-frequency brainwaves associated with intense conscious thought and awareness. "She's conscious," Dr. Murphy said, staring at his monitors in disbelief. "Her EEG is showing fully awake patterns, but she's under deep general anesthesia. This is impossible." As we watched in stunned silence, Evangeline Thorne's eyes opened while she was still under full surgical anesthesia, with her skull opened and her brain exposed. She looked directly at me with completely clear, focused eyes that showed obvious intelligence and awareness. "Dr. Blackwood," she said in a perfectly clear voice, despite the fact that she was intubated and shouldn't have been able to speak, "you need to stop what you're doing. You don't understand what you're interfering with." The entire surgical team stood frozen around the operating table. In 23 years of neurosurgery, I had never seen a patient regain consciousness during a craniotomy, much less speak clearly, while intubated under general anesthesia. "Evangeline," I said slowly, "you're in surgery right now. You were in a motorcycle accident. Do you remember what happened?" Her eyes remained focused on mine with an intensity that was deeply unsettling. "There was no accident, Dr. Blackwood. What you call an accident was necessary to bring me here, to your operating room, at this specific time. The modifications to my neural architecture required a medical intervention that wouldn't occur under normal circumstances." "Modifications?" I asked, my voice barely above a whisper. "What modifications?" Evangeline's gaze shifted to the glowing lesions in her exposed brain tissue. "Those structures you're examining are not pathological lesions, doctor. They're upgrades, enhancement modules that have been integrated into my nervous system to expand the capabilities of human consciousness. I am what your species is becoming." Dr. Chen, who had been standing motionless beside me, suddenly whispered, "Dr. Blackwood, look at the monitors." I glanced at the physiological monitoring equipment and saw something that defied every principle of human biology I had ever learned. Despite being under deep anesthesia, despite having her skull opened and her brain exposed, Evangeline's vital signs were completely normal. Her blood pressure, heart rate, oxygen saturation, and body temperature were all within perfect normal limits, as if she was simply lying comfortably in bed, rather than undergoing major neurosurgery. "You need to close my skull and complete the procedure, exactly as if you had found and removed a standard epidural hematoma," Evangeline continued, her voice maintaining the same calm, authoritative tone. "Document your findings as a successful evacuation of traumatic bleeding. Do not mention the neural enhancement modules in your operative report. Do not discuss what you've witnessed here with anyone outside your immediate surgical team." "I don't understand," I said. "What are you? What are those things in your brain?" "I am human, Dr. Blackwood, but I am also something more. The structures you've discovered represent the next phase of human evolution, guided by intelligences that have been observing your species for far longer than you might imagine. What you're seeing in my brain will eventually be present in millions of humans across your planet." The glowing lesions began pulsating more rapidly, and the light they generated became brighter and more intense. The electronic equipment in the OR started malfunctioning again, and I could hear similar electrical disturbances coming from other parts of the hospital through the walls. The integration process is not yet complete, Evangeline said. My consciousness is still adapting to the enhanced neural pathways, but when the process is finished, I will have access to knowledge and capabilities that are far beyond current human limitations. This is impossible, Dr. Chen whispered. Humans don't work this way. Consciousness doesn't work this way. Evangeline's eyes shifted to Dr. Chen. Your understanding of consciousness is limited by the current configuration of your neural architecture, Dr. Chen. When your turn comes, Mykes, and it will come, Mykes, you will understand things that are incomprehensible to you now. Dr. Blackwood, Evangeline continued, you have two choices. You can complete this surgery, as I have instructed, document it as a routine trauma case, and continue your medical career with the knowledge that human evolution is progressing exactly as planned. Or you can attempt to study these neural modifications, report your findings to medical authorities, and discover that there are consequences for interfering with processes that are far beyond your comprehension. As she spoke these words, the temperature in the operating room began dropping rapidly. Within seconds, the air became cold enough that our breath was visible as we spoke. Ice crystals began forming on the surgical instruments, and the metal surfaces of the OR equipment became painful to touch. What's happening? Asked Patricia Williams, our OR nurse, as she watched frost forming on the walls of the surgical suite. A demonstration of the capabilities you're dealing with, Evangeline replied. The neural enhancement modules allow consciousness to directly influence physical reality through mechanisms that your current science cannot measure or understand. This is a very mild example of what becomes possible when human consciousness is no longer limited by the standard configuration of your neural architecture. The cold in the room became so intense that we could see our breath forming clouds in the air. The surgical lights began flickering more rapidly, and several pieces of monitoring equipment shut down completely due to the temperature drop. I will ask you one more time, Dr. Blackwood, will you complete this surgery as a routine trauma case and document it accordingly? I stood there in that freezing operating room, looking down at a patient who was fully conscious and speaking clearly, despite being under deep anesthesia, with her skull opened and her brain exposed, and I realized that everything I thought I knew about medicine, biology, and reality itself had just been shattered into pieces. The glowing structures in Evangeline's brain were unlike anything in medical literature. They were generating their own light and electromagnetic radiation. They appeared to be communicating with each other through some unknown mechanism, and they were somehow allowing her to maintain full consciousness despite being under surgical anesthesia. Most disturbing of all, she was demonstrating the ability to influence the physical environment around her in ways that violated basic laws of physics. If I do what you're asking, I said slowly, if I document this as a routine trauma case, what happens to you? What happens to the other patients you mentioned? The integration process continues exactly as planned, she replied. Over the coming months and years, you will encounter more humans who have received similar neural modifications. Some will come to your attention through apparent medical emergencies, as I have. Others will simply appear in your community, your workplace, your social circles as ordinary people who happen to possess extraordinary capabilities. The cold in the room was becoming unbearable. Ice was forming on our surgical instruments, making them dangerous to use. The anesthesia equipment was beginning to malfunction due to the temperature drop, and I was genuinely concerned that Evangeline's safety was being compromised by whatever was happening to the physical environment. And if I refuse, I asked, if I report what I've seen here? Evangeline's expression remained calm, but her eyes seemed to grow darker. then you will discover that the consequences of interfering with human evolution extend far beyond your ability to understand or control them. Dr. Blackwood, the choice is yours, but choose quickly. My neural systems are still adapting to the modifications, and maintaining consciousness during this procedure is requiring significant energy expenditure. Looking back now, 4 months after my resignation from Riverside Memorial, I realize that the choice I made in that operating room was the moment my life as a neurosurgeon ended forever. I could have refused Evangeline's demands. I could have continued the surgery, documented everything I found, taken extensive tissue samples, and reported the case to every medical authority I could contact. I could have tried to understand what I was witnessing and potentially help the medical community prepare for whatever was happening to human consciousness. Instead, I chose to close Evangeline Thorne's skull, complete the surgery exactly as she had instructed, and document the case as a successful evacuation of post-traumatic epidural hematoma. The moment I made that decision, the temperature in the operating room returned to normal. The electronic equipment stopped malfunctioning, and Evangeline's eyes closed as she returned to the unconscious state appropriate for a patient under surgical anesthesia. But as I began the process of replacing her skull bone and closing the surgical site, I knew that I had just witnessed something that would haunt me for the rest of my life. And I also knew that this was only the beginning. 3 days after Evangeline's surgery, she returned to my office, not as a patient, but as something else entirely. "Dr. Blackwood," she said, her eyes now permanently luminescent, "it's time you understood the truth." She placed her hand on my desk, and instantly, images flooded my mind. Thousands of humans across the globe, all receiving the same neural modifications. Government facilities where the enhancement procedures were being conducted systematically. Military applications beyond imagination. We are not being invaded, doctor, we are being upgraded. Your species has reached the threshold where biological evolution must be guided, or you will destroy yourselves within decades. The visions showed me wars ending as enhanced humans simply chose peace, diseases being cured by consciousness alone, environmental disasters being reversed through collective mental focus. "But the old humans," I whispered, "what happens to us?" Evangeline smiled sadly. "You adapt, or you become obsolete. The choice is yours, but the transformation cannot be stopped." That night, I found the first glowing lesion in my own brain scan. The enhancement process had already begun. I resigned the next morning, not from fear, but from understanding that neurosurgery, as I knew it, was about to become extinct. The evolution of consciousness waits for no one.